Open heart surgery. It sounds scary because it is, but thanks to technology, doctors have a lot more options today. Adam Bartlemay tells us about a valve replacement that hardly leaves a scar in today's MedWatch report.
They would have to have had open heart surgery to know how bad it is, how severe that is. And it's not so much what they do on the inside, it's cutting you open and sealing you back up. That's a son of a gun.
Colby Sparks would know. He had 2 valves replaced during open heart surgery in 2008, but he recently started feeling like he couldn't do what he needed or wanted to.
And I remember back last spring, the last snow we had was only about 3-inch snowfall. And I was so bad, my wife had to go take off the steps, just the steps. I couldn't even do that.
One of Colby's valves was failing.
So as these valves get older and start to deteriorate, they can start to leak or get stiff and cause symptoms like shortness of breath or really affect the quality of life of these patients. Some patients even require multiple admissions to the hospital just because the valve's not working well.
That means the body isn't getting the blood it needs.
Your brain needs blood, your kidneys need blood, your gut needs blood, your muscles need blood to work. If you can't get blood out of your heart because of a dysfunctional or narrowed valve, then you're not going to get the blood to the places it needs to be.
The good news is, this time around, Colby was a candidate for a much less invasive TAVR procedure.
We were able to do this from the groin. We carried the valve up on a collapsed balloon, positioned it in his existing aortic valve replacement, and the existing valve shows up on our X-ray machine and actually acts as a marker to allow us to precisely position the new valve. Once everything's lined up properly, we inflate a balloon, expand the valve into position, and then deflate the balloon, leaving the new valve pinned in place by the existing valve that he had.
For Colby, the results were nothing short of amazing.
When you can feel it yourself, you know, you don't have to go to the doctor to have a doctor tell you how well you're doing. You know you're doing good. But then again, you've got to understand how low I was down, way down there. And I was down so bad that I couldn't hardly talk on the phone and they could hear me.
I tell you that 10 minutes will loosen you up.
I don't know that I ever felt this good. I really don't. But I don't know how that happened, but I just feel great right now.
For MedWatch, I'm Adam Bartlemay.